The intravenous or IV route of administration is the administration of drug directly into the bloodstream. Because we are using a intravenous preparation, we often can administer the largest volume of drug preparations. There are different ways to deliver intravenous medications. Sometimes we use what is called a intermittent infusion. For example, when antibiotics or pain medications are administered, a nurse will hang a small 50 ml bag with the drug mixed in solution and administer that intermittent infusion over a period of 15 to 30 minutes, and then the infusion is taken down. For maintenance IV fluids, for example, when a patient is dehydrated and needs extra fluid, a volume of fluid is delivered via an infusion pump over a period of time with a certain number of drops of fluid per minute of infusion. A quick delivery of intravenous drug is called an IV bolus, where the nurse will often push via a syringe a volume of drug directly into the vein and then allow some maintenance fluid to flush it into the system and through the line. So to recap, there are three main routes of drug administration: the enteral, the topical, and the parenteral. If you think about how we defined those, you can also critically think about the onset of action based on the general route of administration. Whenever a drug needs to cause a therapeutic effect in the body, it needs to be absorbed and distributed into general circulation and brought to the target tissues. Therefore, it stands to reason that the intravenous route is going to be the most quick in causing a response. In general, the parenteral route is going to be the quickest onset of action, the topical route next, and the enteral route is going to be the slowest onset of action. Again, parenteral route, we're putting the drug very close or into the veins, which sends it through systemic circulation. That's why the IV, IM, sub-Q, and ID routes of administration are going to have the rapidest onset of action, with the IV being the quickest. Next, the topical routes are being placed onto the surface of the skin or mucous membranes, below which are multiple capillaries that can quickly and readily absorb the drug into the bloodstream and get circulated. Enteral routes of administration have to first go into the gastrointestinal tract, get broken down and absorbed through the mucosal membranes of the GI tract and into the circulation, hence are the ones that are the slowest onset of action.